Thanks for watching this quick video on fetal monitoring devices. My name is Catherine and I'll be walking you through some of the benefits and use of wireless EKG devices. To begin, let's review types of fetal monitors. Cardiotocography, or CTG, is the recording of fetal heart rate and uterine contractions using an electronic fetal monitor and was introduced in the 1960s. CTG commonly uses ultrasound and TOCO as seen in the top left photo. Wireless monitors are on the market, such as the Novi, which uses EKG technology to determine fetal heart rate, maternal heart rate, and also picks up uterine contractions. Most but not all new wireless devices use EKG technology. Other types of monitoring include handheld Doppler, often used in doctors' offices, during prenatal visits, and stethoscopes used globally when other methods are not available. Fetal scalp electrodes, or FSEs, are often used in labor after membranes are ruptured, as it attaches directly to the fetal head with a small electrode and transmits an EKG signal that can be connected to a CTG monitor in place of a Doppler wire. This is not a wireless method. Ultrasound, or Doppler CTG, is at times unable to distinguish between maternal and fetal heart rate. At times, the Doppler will record maternal heart rate as fetal heart rate, which can be problematic when trying to determine fetal status. This happens more often with a larger maternal habitus, or BMI. When comparing wireless EKG monitoring to ultrasound monitoring, the wireless devices were shown to be more accurate and performed as well as an FSE, with over 80% of EKG signals being interpretable in a short period. EKG devices can determine fetal hypoxia better than ultrasound monitors and can reduce unnecessary interventions with more data to determine delivery route, improving maternal outcomes. Benefits of use include mobility with freedom of movement. Wired fetal monitoring prevents walking around the labor room and limits other positions such as lunging and stretching, as wires are often cumbersome and get in the way of movement. Wireless monitoring facilitates movement in labor, which is shown to reduce the length of labor, and many new devices are able to be worn in water. For higher BMI patients, studies consistently show that monitoring was successful with a higher BMI, which is often problematic for ultrasound monitoring. For remote monitoring, non-stress tests, or NSTs, can be performed remotely with wireless EKG devices. Use of these monitors for NSTs outside of a hospital setting can be completed with minimal training for mothers. Remote home monitoring can be used for low-risk, intermediate, and high-risk patients, and is beneficial for maternal and fetal safety with a high participant satisfaction score. Wireless EKG monitors improve access to care and can be assessed remotely via telehealth, as they record both fetal heart rate and uterine contractions. These devices were designed for self-administration at home and were more accurate than the commonly used ultrasound CTG, as it is unaffected by BMI. This device is a great option to women and providers seeking remote or telehealth solutions for routine monitoring such as NSTs and labor monitoring. EKG devices were determined to be useful in determining fetal oxygenation status, which is clinically important to determine if a fetus is becoming hypoxic in labor and if vaginal or cesarean delivery should be utilized to proceed with delivery, also reducing maternal morbidity and mortality. Critical congenital heart defects, or CCHD. Currently, detection of CCHD relies on ultrasound scans. However, fetal EKG monitoring combined with artificial intelligence has shown promise in the detection of CCHD as a non-invasive detection method. EKG data can be collected remotely over 5 minutes in 99% of patients, with minimal instructions, and can be performed remotely at home and accurately, as detection rates outperformed sonographic screenings with a specificity of 77%. Here are the references. Thank you for watching.